Welcome to this space dedicated to the dissemination of scientific knowledge designed for specialists, general practitioners, and students, as well as the general public interested in health. In this edition, we present a detailed analysis of the study titled Retrospective Study of 32 Kissing Aneurysms, Radiological Detection, Microsurgical Clipping, and Functional Outcomes, a fundamental work for understanding the management of these rare and complex cerebrovascular lesions. This research was published in 2025 by Dr. Ernesto Roldan Valadez in collaboration with a distinguished team of specialists. Throughout this video, we will explore how the team analyzed the clinical and radiological characteristics of these unique kissing aneurysms, which consist of two adjacent lesions with adherent walls. We will also identify key findings regarding the accuracy of preoperative diagnosis through digital subtraction angiography, the success of microsurgical clipping, and a critical factor explored in the study, the influence of patient age on the risk of aneurysm rupture. We begin this journey through medical science made in Mexico.
Legal disclaimer. This material is for educational and scientific dissemination purposes only. Its goal is to democratize access to the knowledge generated in specialized academic publications. Due to the dynamic nature of medical science, the information presented reflects the data available at the time of the original article's publication and may be subject to subsequent updates. Not medical advice. Under no circumstances does the information presented constitute a medical recommendation. The graphic resources used are only a representation of the article presented and are not completely accurate to human anatomy. For more information, you may pause the video.
Today, we're going to dive into one of the most fascinating puzzles in all of neurosurgery, something called kissing aneurysms. Now, these things are rare, they're deceptive, and they are incredibly complex. We're going to be looking at them through the lens of a huge 20-year study that followed 32 cases. It gives us this amazing, unprecedented look into how surgeons figure them out, how they manage them, and ultimately how they solve this really high-stakes medical mystery. So this is a central question, isn't it? It sounds a little dramatic, sure, but for a surgeon, this is a very real, very serious anatomical problem. What actually happens when these weak spots on the blood vessels in your brain are nestled so close together that they're literally touching? The answer, well, it can have life or death implications. Okay, so what exactly are you dealing with here? I want you to imagine two tiny balloons inflating from two different spots on a network of tubes. Now imagine they've grown so close that their super thin walls are now pressed up against each other, or kissing. That's the absolute key. They have separate origins. And that means a surgeon has to deal with two distinct problems, not just one. And that's where the challenge really begins. So you might be wondering, just how rare are we talking? Well, over a 20-year period at a major neurosurgery institute, they made up just 2.3% of all surgically treated aneurysms. That's it. Their rarity is exactly what makes every single case a critical opportunity to learn, providing just invaluable data for future treatments. Now, being so rare leads us straight into the first major hurdle, the diagnostic challenge. Because they're so uncommon and their anatomy is just so deceptive, figuring out exactly what you're looking at before you even get into surgery is a massive puzzle. This right here, this is the classic case of mistaken identity. On one side, you have a single aneurysm with two lobes, kind of like one balloon with a big dent in the middle. See, it has one base. But on the other side, you have our kissing aneurysms, two completely separate balloons, each with its own neck. On a scan, they can look dangerously similar, but for a surgeon, that tiny distinction changes absolutely everything. So how did doctors solve this puzzle? Well, they turned to the gold standard, something called Digital Subtraction Angiography, or DSA. You see, unlike a normal MRI or CT scan, DSA creates this dynamic 3D roadmap of your blood vessels. It does this by digitally erasing the skull and brain tissue from the image. This lets surgeons see the exact origins and necks of the aneurysms in just incredible detail, which is often the only way to tell them apart before an operation. But here's the thing, even with the absolute best imaging we have, it's not foolproof. In a full 12.5% of the cases in this study, the true nature of the aneurysms was only discovered during the operation. Just think about that for a second. Imagine planning for one problem and then mid-surgery discovering a second, intimately connected one. It's really a stark reminder of the incredible skill and adaptability that's required in that operating room. So, given how hard they are to diagnose, understanding the risks becomes even more critical. What did this 20-year study actually reveal about who is most at risk and where these dangerous formations are most likely to pop up? The study uncovered a pretty striking pattern. Nearly 60% of all kissing aneurysm cases happened in the exact same neighborhood of the brain's vascular system, a very specific segment of the internal carotid artery. This really suggests that the unique blood flow and the structure in this tiny area create the perfect conditions for these twin aneurysms to form. And here's a really crucial takeaway for doctors. The statistical analysis from the study found a clear pattern. While the aneurysm's location wasn't tied to a higher risk of rupture, the patient's age was. Patients who had a rupture were, on average, older than those whose aneurysms were stable. This finding really highlights just how important close monitoring is, especially in older patients. All right, so we have this rare condition, it's hard to diagnose, and it carries some serious risks. So how do you fix it? Well, this brings us to the solution, the art of precision microsurgery. And this isn't just a procedure, it's more like a meticulously planned and executed surgical performance. The surgical strategy is really a masterclass in detail, and it's broken down into these key steps. First, there's meticulous planning to choose the perfect surgical approach for each unique patient. Second, and this is the most delicate part, the dissection. This is where the surgeon has to carefully separate those touching aneurysm walls without causing a rupture. Third is strategic clipping, where they place tiny titanium clips on each aneurysm's neck to seal it off from blood flow. And finally, constant verification, using tools like an intraoperative Doppler. It's like a miniature ultrasound to confirm that while the aneurysms are secured, healthy blood flow to the rest of the brain is perfectly preserved. So after all of that complexity, all of that risk and incredible precision, what was the verdict for these 32 patients? Well, this is where the story shifts from being a clinical challenge to one of remarkable success. The results, well, they really speak for themselves. Despite every single challenge, a staggering 87.5% of patients had what's called a favorable functional outcome. I mean, that's a huge testament to the surgical team's expertise. For one of the most complex cerebrovascular issues out there, this is an overwhelmingly positive success rate. But what does a favorable outcome actually mean for a patient? Yeah, it's really important to understand what this means. We're not just talking about survival here. We are talking about quality of life. An MRS score of 0 to 2, which these patients achieved, means they were left with no symptoms at all, or maybe only a slight disability. But they were fully capable of looking after their own affairs and living independently. It's a return to normalcy. You know, the study's authors summarize their findings perfectly. As you can see, success isn't about some single magic bullet. It's really a three-part formula. You need accurate imaging to see the problem, you need individualized planning to strategize the solution, and you need that intraoperative assessment to verify your execution. Every single part is essential. At the end of the day, the story of kissing aneurysms is just a powerful reminder. It shows us that even when you're faced with a rare, deceptive, and surgically demanding puzzle, the combination of deep expertise, meticulous planning, and surgical precision can turn a potentially devastating diagnosis into a story of incredible success.
The reference for the article from which this information was extracted is displayed on the screen. Thank you very much for your attention and for joining us until the end of this analysis. If you found this review helpful, we invite you to share it with colleagues, residents, students, and anyone interested in these topics. Don't forget to subscribe and turn on notifications. This material is for educational and scientific dissemination purposes only.